right. Good morning, everyone. Don't know how much you can see of my office here, but my dog Madeline moved to the other side. Normally she's behind me. And we are a team, a therapy dog team for St. John Ambulance. So she's usually with me. I got her during COVID, and this is where she spent a lot of her time. So I'm introducing Madeline as well to you. If you can see her, she might move around a little bit. First off, I want to thank you, especially for the work that you do, the care you provide, and for showing up for this conversation that, if we're honest, it's not easy. But it's a conversation that I have a lot because I have lots of personal experience in this area. So it's important for me to be able to share my own experience, and hopefully you can learn from it. And if I only knew then what I know now, I might not have gone through what I've gone through. So I hope you can benefit from my experience. So we're here really to talk about something that sits right at the intersection of your health, your resident safety, and the future of our healthcare system, actually, which is burnout. So as we move along, I will ask you some reflective questions, some just to think about quietly, and some you can respond in the chat because Carissa will manage that for me. She's wonderful. First of all, I'll start off with something that I really want you to think about throughout. Don't necessarily need to answer that now, but think about as we go along in this conversation, what feels most familiar to you in your experience. So the cost of caring. I call this talk the cost of caring because that's really what burnout is. It's not a sign that we don't care. It's actually what happens when we care deeply and we're asked to do things inside a system that's stressed beyond its limits. So today's not about blame. It's not about judging individual resilience or, if you're tough enough. It's about looking honestly at what burnout is, what's happening at the levels we're seeing in healthcare, and what we can do as individuals, as leaders, as teams to change those conditions that are all around us. So my hope is that you leave this session with a few things. So the language, you're comfortable with language for your own experience. And you can recognize that in yourself and in others that you work with. A clearer picture of what actually is driving burnout in healthcare, and a sense of hope and practical direction. So things that you can start doing and advocating for right away. So I will share in the next couple of slides some data, but it's not, just to give some context, but it's really about the human side of burnout, this talk, and our stories, our nervous systems, our families, our residents. So let's start talking about the cost of what care looks like in numbers. So when we talk about burnout, it can feel abstract until we do put some numbers to it. So this is pretty general at this point. So across Canada, in the general workforce, depending on the survey, around 4 in 10 say they feel burned out, which is already high. But when you jump into healthcare, the picture gets certainly much more intense. I probably don't have to tell you that. Nationally, nurses consistently report very high levels of burnout symptoms, often in the range of 75 to 90%, which is shocking for the general workforce, but probably not for you. Among public health workers, one large Canadian study found nearly 8 in 10 meeting burnout criteria. In BC, even before the pandemic, we saw over half of nurses reporting high burnout symptoms, and many now saying they're looking at either leaving their role or even leaving their profession altogether. So that tells us, that it's not just statistics, it's an alarm bell. And as with our cars, when we see signals and alarms going off in our cars, we take care of them right away. Sadly, we don't often do that as humans, and particularly humans in caring professions like yours. So it also tells us that the system is drawing down more mental, emotional, and physical energy than it's putting back in. And so, but people, you are still showing up, you're still caring, you're still trying to do your job. the best you can, given what you have. So from a more specific to long-term care and BC perspective on the next slide, um, burnouts, it's not normal. It's becoming more the norm in the workplaces, but it's not normal. But it's not the exception either. So in many long-term care facilities, nearly half or more of the staff show clear signs of burnout. You can see the numbers there. But it's really important, and I say this every time I do this talk, that burnout's not benign. We throw the term around, and maybe we do, maybe we don't take the term seriously, but it's very, very serious condition, burnout. It's not a one and done. Burnout can happen over and over and over again. Like the flu, like any virus, you can continue to get it if you don't take protective care. And there's, a chronicity to it. And personally, I've burned out more than once. And I will tell you that every time you do burn out, in my experience, it's a new set point, or it's a new baseline. So you start burning out sooner, you burn out harder every time it happens to you if you don't really take it seriously and take care of yourself. So even before COVID, again, back to the numbers in BC, long-term care nurses were already burned out. The pandemic just intensified that, which you can imagine. And it's a system issue. It's not a resilience failure. So if you come away with nothing else, I want you to come away with that. It's not a system issue. It's not a resilience issue of the individual. It's really, and we'll get into the shared responsibility, but it's a system issue. And burnout rises with chronic understaffing and limited recovery time. At a minimum, which we'll get in more details. So let's move from the numbers to the lived experience. There are, on the next slide, at least 3 layers of costs here. The human cost, so to your health, your identity, your family, your sense of well-being. The safety and quality cost to your residents, the people you care for, be they residents, clients, patients, whatever, however you're coming to this, and your teams. And there's a system cost. So the recruitment is difficult. I'm sure you're experiencing that. Retention is difficult. There's disability increase, turnover increases, and the loss of experience and expertise. We call that in the corporate world, loss of corporate memory goes out the door with the experienced and good individuals that can no longer stay. So when we ignore burnout, we're not just ignoring well-being. And we really need to understand that. And we really need our leaders and those that are making the decisions about our resources and so on to understand that this isn't about ignoring just well-being. We're quietly accepting a safety risk and a sustainability risk for the whole system. So I want to be clear right from the start. Burnout's not a personal failure. It's a system signal. And like any safety signal, the caring thing we can do is just listen to that signal and take action. So if you're comfortable, and we'll do a private check-in, you can put it up if you're comfortable, or keep it quiet. On a scale of 1 to 10, how drained have you been feeling lately? Are you closer to tired but okay? Are you closer to, I don't know how long I can keep doing this? Again, you don't have to share it, but keep that number in mind, at least as we move through the presentation. So on the next slide, the World Health Organization describes burnout as the following. There's 3 features that for clinical burnout. So exhaustion, so that depleted energy, feeling drained, cynicism or mental distance, detachment from what you're doing, who you're caring for, who you're relating to, negativity, and reduced effectiveness. So lower performance, diminished capacity. I'm sure some of these sound familiar. But that's really not, how, sorry about the phone ringing in the background. That's not how most of us describe what's happening to us. We say things like, I don't recognize myself anymore. I'm numb. I cry in my car before my shift. I'm short with people I care about most. It shows up in the body as sleep problems, headaches, gut issues, constant tension, the migraines, which happened to me a lot, getting sick more and more often, or taking a long time to recover, feeling wired and tired at the same time. Emotionally, burnout can look like going from compassion to irritability, feeling detached, feeling like nothing you do is good enough, or starting to see your residents and colleagues as tasks rather than as people, just to get through the day. And then there's this is something we don't often think about, the identity impact. So when your work is part of how you see yourself, I'm a nurse, or I'm a care aide, I'm a leader. In my case, I'm Miss Healthy Workplace, we'll put it that way, Miss High Performer. Burnout can feel like a crack in who you are, not just how you feel. So it starts to, in my case, undermine my confidence, and I started to feel like a fraud, which you can imagine the cascading effect of that. So for many, the language we use about ourselves during burnout is really harsh. So, I used to say, what's wrong with me? Why can everybody else handle this? And I can't when I used to handle this. Now I don't maybe trust myself. So burnout really, though, is what's happening when caring people operate in uncaring conditions for too long. We can all do something for a little while, but we can't do this for a long time and consistently. That doesn't mean that there's no personal responsibility. Of course, there is. And we'll talk about boundaries and resilience, but it does mean you can stop labeling yourself as not strong enough and instead ask, what load am I carrying? So when you do a check, what load am I carrying, under what conditions, and with what support? Often one of the first steps in healing is simply naming your experience without shame. So perhaps, Carissa, we could put this, I'll ask this question if you want to go to the chat box and reflect on, what beliefs do you think keep you pushing past your own limits? Because that's a common thing that we see during burnout that we experience. We're pushing past our own limits. So what beliefs keep you from pushing past, about yourself, keeps you from pushing past your limits? Or the organization, what beliefs keep you pushing past your limits?
Keeping an eye on the chat here.
Okay, what are you
I know
seeing?
maybe you could give an example as people are typing.
So I believed, because I was an elite athlete myself and I worked with athletes, that if I pushed harder, if I just worked harder, pushed harder, coped better, that that's what was required of me, and it would change things. But it doesn't. And we'll talk a little bit more about that as we go on. It really doesn't. If you believe I need to be able to do everything or I'm weak, absolutely. Um, that's pretty common. And really, what I'm wanting to get across is, yes, we have personal responsibility here, and we need to do, and we'll talk about it, bring our best selves to the workplace, but um, it's a shared responsibility. So it's not just you. It's not that you're weak. From someone else, what did I see?
Like letting people down if I don't push through, which is very true. If I don't meet performance expectations, I will lose my job and have no income to survive.
hmm, yeah, that's where the whole system piece comes in. So we'll talk about that and what agency you might have around that. Okay, great. So why do we break? Root causes. Let's talk about that. Um, Hearing what I just heard and what I've shared with you, I want to offer a different reframe from I'm weak, I need to push harder, what's wrong with me? What if we start thinking of burnout instead of a weakness, rather as overusing our strengths? So this came to me. I read an article when I was in throes of burnout myself and in denial, frankly, because I was a leader and I was Miss Healthy Workplace. I read an article by a CEO, Anastasia Hinsa. So I used to read a lot of leadership and high performance information, and she was the head of this organization. Push, 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 corporate selling, research, on and on. And she was pushed so hard and pushed herself so hard, a lot of the symptoms I talked about prior, but she ended up rushing to a meeting and falling downstairs in a stairwell and really hurting herself and knocking herself out of commission. So what she described when she described and realized she was completely burned out and couldn't continue. So as it relates to high performance, it related to me and it really resonated, given our common background. But she didn't want to talk about it with anyone or share it with anyone, which I was feeling as well, because there is a real self-stigma, or there can be, associated with burnout, thinking you're weak, thinking it's just you, and so on. So we resist reaching out for help and don't necessarily associate the signals our body's sending. So the migraines, the lack of sleep, the irritability, all those things we talked about, and you push past your limits. So there's a tendency, she talked about, for her to override her buttons, and certainly in signals it was for me. So therefore bypassing any opportunity you had to recover, chance for recovering before you hit the wall. So I think of it now, and I started to think of it then, about overusing my strengths. So our keen ability to focus, our ability to push through, our resiliency skills that we may have, and more often than not, if we push past all that, we get way over our skis and it becomes too, if you will, an athletic reference, a skiing reference. And then it may be too late to pull back. And we don't even necessarily recognize that that's what's happening because we're so used to doing that. So she noted, and I can attest to it, and I've mentioned it, some of us really need to hit the wall. And I'm one of those people where you really have to shut me down before I stop. And some of you may feel that as your natural personality. Some of you may feel that because this is your job, you need your job, you have to keep going. And then, often we misdiagnose that we're not tough enough. And that's why we're in this situation. We reach for the wrong solutions that really don't help at the end of the day, like more yoga, let's do more overtime, let's do more paperwork, all those things, thinking they're solutions when they're really not. So another question for you in the chat box, Carissa. So everyone, what signs of burnout for you, are easiest, do you think, for you to ignore? If you think about all those things we talked about so far, the migraines, be it personal, physical, psychological, what signs of burnout are easiest for you to ignore?
We have cynicism, being tired, procrastination.
That's a good one. I do that. You'll procrastinate. Um,
That I'm putting my own needs last again.
yeah, yeah. Okay, so let's look at this next slide, which really talks about the drivers of burnout. So we'll give you a little more info here. Um, so now we'll move a little bit from the personal. We'll come back to the personal, and we'll talk about it here. But I'll zoom in a little bit on in the workplace level. So these are patterns that we see over and over in the workplace that drive burnout. So the unmanageable workload, the chronic understaffing, constant interruptions, time pressures, doing more with less, unclear expectations. That's really frustrating and messes with your head. Shifting priorities, lack of control over your schedule, breaks, how the work's actually done. Moral distress. So what that means is really being unable to give the care that you really want to give, or it's incongruent with your own values, the demands on you. limited psychological safety. We'll talk a little bit more about that, but where it doesn't feel safe to speak up and say, I'm not okay, or I've made a mistake, or we have an issue here, without fear of retribution, embarrassment, humiliation, whatever. So there's a moral distress, psychological safety. But at a personal level, um, many people in healthcare, they share traits, and this is often overlooked. And I learned this. Um, People in caring professions, they share traits that are beautiful. Don't get me wrong, but they're risky when the system's strained. You're often empaths and caregivers, for sure, inside and outside work. So you're not only taking care of everyone at work, you're taking care of your families and so on. You're high performers, so you have a strong sense of responsibility. You carry perfectionism, where you've got to get things absolutely perfect, and that certainly corrodes your energy levels, your confidence in yourself, puts pressure on yourself and the teams. You have a hero narrative, and not negatively, but you're thinking, if I don't do it, who's going to do it? You may have complex loads at home with your kids, aging parents. I mean, this was part of my problem. I was in a really high stress job, political job, and my mom was dying. I was her primary caregiver. She was in long-term care. I spent a lot of time there. Um, at the same time, I had two dogs, and one of my dogs died that I'd had for 14 years. And I was under a lot of stress in that role. So it was kind of this perfect storm of issues, which drove me into actually, all that stress drove me into an early menopause. So I was having hot flashes every hour, 24 hours a day. I wasn't sleeping, which made everything worse. I didn't understand what was going on with the hormones in my body. It's really caustic, this burnout. But it happens where these personal strengths that we have that are beautiful as a caregiver, but they're colliding with the demands of the system and the system realities. So this moral injury that I've mentioned, um, is that feeling of, I know the right thing to do, but the system's not necessarily allowing for me to do that, given different circumstances. So the problem with moral injury, other than that and the obvious, is you start losing trust in the system because of it. You lose trust in your leader and the leadership team, and you also sometimes you lose trust in yourself. And that's what happened to me. I started having a real issue with my own confidence. And everything I started to do, I was overthinking, and I didn't think I was good enough, when clearly the evidence suggested over my career I was, but you couldn't have told me that at the time. But this is where, leaders in the organizations really can and they must make a big difference by not only reducing the shame and the stigma, self-stigma around burnout and mental health, but also, most importantly, providing that safe space and supports and resources. So, and normalize the conversation around mental health in the workplace, because that'll do a lot to mitigate the incidence of burnout. So, the next slide, I really want to talk about common signs of burnout. So we talked a little bit, but I want to spend a moment on this because it's too important not to recognize these symptoms in yourself. And it can be really difficult because, as I said, I didn't do that. And I'll tell you, despite all of the evidence, I didn't see it either. And I'm in this business. And so I'll tell you, it's tough. Often when you're in the, or you don't really realize how bad it is, I guess. So these are some things that you can think about, have them on your list. If you start noticing an increased incidence, are you absent a lot? Are you late a lot? Your productivity's down, the quality of your work's down, which is really scary in healthcare. Your relationships are corroding with your coworkers. You're having a hard time focusing, missing deadlines, and so on. You don't want to go to those social events that are being provided. You don't want to go to the Christmas party. Changes in your social habits, and this is something where I had a really clean diet and a really clean lifestyle, I started, I couldn't wait to have a glass of wine. So I couldn't wait to get home at night and have a glass of wine, and that turned into 2 glasses of wine. And then I associated that with alcohol with feeling better. And my husband noticed and said, like, who are you right now? Which just added to the problem. But I felt that that was a way for me to numb myself and for me to feel better. Um, Symptoms manifest physically, psychologically, and socially. So it's important for you to be looking at all aspects of that in your own life and those you work with, because if you notice this is happening in your colleagues, it's really important to understand, how do we communicate about that? How do we get some attention around this and start to make changes? According to Gallup's research, it consistently shows the research that no one has more powerful influence over employee burnout than their immediate manager or their immediate leader. So leaders within the organizations need to be trained. And this is something I did at Canada House, and we talked about in the intro, developed a overall mental health strategy within the organization for 50,000 employees and 20,000 part-time employees, worked with the EAP provider to create a training program for anyone that led people within the organization. So they understood what mental health is, what mental illness is, the difference between them, and how do I recognize symptoms in myself and in others, and what's the right language to approach when need be? How do I intervene appropriately? So the good news is burnout has root causes. It's not inevitable that people burn out, and we can address the causes, not just symptoms. So there is a ripple effect, and we'll talk about that next. So let's connect that directly, this ripple effect, to what most matters to you, which is the people you care for and the teams you're working with at work. So when burnout's high, we see predictable ripple effects. So certainly safety and quality. So when you're tired, you're mentally tired, the chance of errors and mistakes, near misses increases, of course. When your brain bandwidth is low, you're more likely to not necessarily notice changes in the resident's health or their behavior that's important for you to notice. Communication, so under stress, our communication shortens. We get more transactional with our interactions, so we default to that instead of, really relating like humans. Tension increases in our teams. Conflict increases. I mean, some of this is probably familiar. For your residents and family, they experience it. I've experienced this in the healthcare system when I presented ill over an emergency, ill over COVID. Um, I felt that coming from the staff. I understand it, so certainly I was sympathetic, but at the same time, I'm in emerge. So that's one of the common things that happens. The team culture. What happens is if it's an unhealthy or toxic culture you're working in, anyone new coming into that culture experiences that, they either adopt those same behaviors or they leave the organization, which is not always a bad thing if it means surviving yourself. Easy to say, not easy to do. I recognize not. I've done it. I've left organizations. I left roles I love to try to recover because it can be life and death to you as well, and corrode everything in your life. So it's super super important. Um, Leadership, one thing I often say as well, leaders, employees monitor, mimic, and magnify the behavior of their leaders. So if your leader doesn't have the right skills technically, or they don't have the right resources or emotional EQ for the role, or the resources, supports that they need to lead appropriately, and I often say leaders are people too. It's pretty tough. You're pressurized from all directions. And the consequence, though, um, for a leader and the organization can be devastating to everybody, and a negative ripple effect. When we invest therefore, in reducing burnout, of course, we're not just doing a nice wellness thing, we're reducing the safety risk for everybody. We're increasing the quality of care, and we're protecting, and this is an important one too, the long-term viability of not only the system, but your profession and the people in it. That's why when I talk about cost of caring is both a human and a safety and a system issue. So when you protect as a leader the people that work within the system, then they protect the people that they care for, and that protects the integrity of the profession all over. So that's the ripple effect. The other ripple effect is in your family, of course, and the relationships you have there, and whether they survive or they don't survive. So, yeah. So let's shift now to some hope and possibility without sugarcoating it. So resilience, first of all, quick distinction. It's not about tolerating harm better, period. And that's what I was trying to do, and it wasn't good. It's about having really, resilience is about having the energy, the support, and the boundaries to stay whole and doing meaningful work and being able to do it even in a system under stress within reason. An individual level, there are some pillars that you might want to think about and keep in mind that you find helpful. So I've put them in a star. So you can be a star, but this is how really I learned to lean into prevention and to be aware of what's happening, what I need to have in place for me to thrive within that organization and really in life. So from a recovery perspective, so you have to actually get rest. So not just collapsing, and it's not just about sleep, it's about mental and emotional rest. These need to be priorities in your life, not just in your work. But in your work, think about taking micro breaks during your shift, maybe stepping outside when you need to, taking 3 deep breaths before you enter into a new room to take on the next situation. From a renewal perspective, think about things that put something back in your tank. Maybe it's the relationships with the people that help you feel safe and secure in your life, people you can talk to. I have that. I have a very, very supportive partner and my husband, Eric, and I have lots of great friends that I can talk to. I have professional colleagues that I've talked to over the years that help me. I also have animals are amazing. I got involved in the therapy dog program with St. John Ambulance, which really fills my cup. So there's that. Practices, so nature, movement, reading. I can lose myself in a great book. I love movement. So I'm a Pilates person. I'm about to take Pilates teacher training. I've been doing Pilates for 20 plus years now. Yoga, maybe it's a spiritual practice. Whatever is meaningful for you, you have to keep doing. Establishing boundaries. Now, this is a tough one in our lives, not just at work. But saying, I can't take this on right now, recognizing when you're past a safe capacity and allowing yourself to be human, not heroic all the time, is really important. And the self-awareness part, you hear the term thrown around, but it's really important to know your warning signs, right? Like is it irritability? Is it emotional numbness? Is it you're forgetting things, you're making mistakes? Are you leaning on substance abuse, be it alcohol, marijuana, whatever it may be? What is it for you? So recognizing that. I'll tell you actually what really got my attention, and believe this or not, my second dog, Myra, I had conflict in my relationship, of course, because I was feeling all those things and reacting negatively and just kind of hanging on. And I was walking my dog, and I noticed a pattern with walking my dog. She was a terrier anyway. She wasn't a golden retriever like Madeline, different personality, but I did recognize that her personality changed when I was walking her. She started not fighting with every dog that we met, but she was certainly barking and in conflict. And I'm thinking, what is happening here? Why is this happening? And it occurred to me that as they do, they pick up on your energy. They can tell when you're stressed. They can tell when you're rushed, when you're anxious. That's why we have a therapy dog program in Canada and across the country, because they pick up on it. And I was really in tune with my dog. So when I recognized that, not only I felt so bad for transferring that energy to her, but it really got my attention. Like, seriously, at the end of the day, that's what did it, despite all these things. So I'll share that with you as a bit of a tip. But that's one of the things that really broke my heart, actually. So anyway, there you have it. So now I want to acknowledge, of course, that not everybody has access to, breaks and therapy and flexible schedules. But really, when you are getting past, you think you're really out on the ledge or over your skis, seeking professional help. I saw you have an EAP program, you have benefits. Talking to professionals is critical to try and get you back on track. So, but that's why we also talk about organizational responsibility. So individual resilience is critical. You bringing your best self to work and doing all you can to strengthen your capacity to perform at your best, of course, and to have fun in your life. I mean, that's what life's about, is enjoying it. But it's also the collective and system resilience in an organization is critical, and it's just as important. So let's move on to, we'll finish the last few slides by talking about, so on to culture where people can thrive. Let's talk about what good culture looks like and at a leadership level. So a healthy workplace, I spent a lot of time doing this, a lot of years working with organizations, doing this long-term care, acute care organizations, for sure. But a healthy workplace culture, it's a shared responsibility, full stop. So for the individual, as I said, to bring your best self to work every day, that means constant focus on your well-being and doing what you can to optimize that. But the responsibility of the employer is to provide a physically and psychologically safe and healthy environment that supports and sustains and amplifies your good work, right? And your ability to do great work. So these are cultures where, and I know it might sound like a pipe dream, but it's happening across the country and in healthcare organizations. I mean, I've worked across the board, public, private, small, large, and multiple industries, including healthcare. Organizations are doing this. So cultures where people can really thrive, and there's key common components. So they focus on psychological safety, which I'll talk a little bit next in a little more detail. But basically, some of the things they have in common is psychological safety, workload, role clarity, and that shared responsibility. So psychological safety, I touched on it, but it's where people can speak up about their concerns, what's going on, their own well-being, so they're not afraid to be punished or humiliated or fired. Leaders respond with curiosity, not immediate blame. They have healthy leadership behaviors. They model those healthy behaviors. They check in with you, want to know honestly how you're doing, and they actually listen when you answer. They're transparent about, what are the limitations, what are the constraints, while really doing what they can to remove unnecessary friction and really letting you know what's happening in the big picture. Workload and role clarity. It's a pet peeve of mine. Clear expectations and realistic expectations. I know that may be hard to come by these days, but that's key in a healthy organization, and working towards that constantly if it's not there now. Having honest conversation about priorities and what you can stop doing, what's really necessary, and shared responsibility again. So burnout's not pushed back on the individuals, it's self-care. Instead, it's talked about as a shared challenge that you're all tackling as a team. And what are the things you can actively work on? So you might not control policy at your level, budget, staffing, and so on, unless you're a leader, and you can do that. But almost everyone in the room, regardless, we all have some influence. We all have some agency. So we can control how we talk to each other, how we talk to colleagues, how we respond when we're struggling. That's building your resilience and understanding the skill set and being aware of your responses and where you are, where your light is, um, and whether you normalize a toxic culture or a difficult culture and say, okay, well, this is just how it is, and we have to accept it, right? So those, these are some of the common features of a healthy workplace. So on this slide, I want to talk to you about from an organizational level. You may or may not know, and these are made in Canada, frameworks, standards, training designs that we have created. And this is some of the research I was involved in at the very beginning of my career, establishing, what are the roadmaps to get there? Because this really can be overwhelming. And one of the most recent things, I want to say it was 10 years ago, we developed, it might have been longer, time flies. But with the Canadian Standards Association and the Mental Health Commission and experts across the country like myself and others in this space, we developed a national standard for psychological safety in the workplace. And it is a voluntary standard. There are 13 items on this, so 13 areas of psychological safety in the workplace to be focused on. But there's a roadmap that's developed for those in your organization and you to follow. But it starts with commitment from leaders to be able to develop this and move it forward. But it exists. So, and it exists across the country. There are resources there. It's free to access. Workplace strategies for mental health. I see that there. If you go on that website, there's a ton of resources there for the leaders, for you to understand more about this. How do we do it? I have a note here somewhere. Your Safe Care BC, which is workers' compensation in British Columbia, your health and safety regulator in British Columbia, they specifically and explicitly recognize psychological health and safety as part of the employer's legal obligation to protect the worker. They treat psychological, WorkSafe BC treats psychological risks, bullying, harassment, certainly violence, toxic workloads as legitimate hazards in the workplace that an employer must prevent and manage, just like the physical hazards like violence in the workplace, like slips, trips, and falls, safe handling, and so on. And WorkSafe BC actually has a framework for success where they tie the standard and those 13 items to the occupational health and safety standard. So that information's there. There's lots of support through WorkSafe BC to assist as a leader or as an organization to get this going. I also have Excellence Canada there. I worked with them and for them for a long time as a consultant. We developed healthy workplace standards, mental health at work standards. So those are all there. They're roadmaps. They tell you the right thing to do at the right time, so you don't have to figure this out. This has been years and years of us doing this. Wellness Works Canada, again, that's a website where you can link in, see the resources. You can get people within your own organization trained, be it HR, be it someone in the organization as an interest. All this information's there. I mentioned WorkSafe BC. They also have, all these organizations or most have consultants or folks that will come in and help train your teams, train your leaders. There's really no reason anymore to not go there and get the information that you need. So here's a few, maybe 4 reflective questions that you can take back to your organization if you want to get started on your own. That you can take back to your team. So some questions asked. So one is what is one small change we could make together that would meaningfully lower the stress in our day? How can we make it safer for people to say, I'm not okay, or this is too much? Where can we build in every tiny bit more recovery on the shift? And what supports do leaders need so they're not burning out quietly while trying to take care of everyone else? So if you can take those back and get started with that and look into the resources that I mentioned, you'll be overwhelmed with what's available to get you started. So imagine for a minute, and this is, we're closing out now and leave you with some words. Imagine for a moment what it would feel like to work in a culture where burnout's responded to with compassion and action, not judgment. And asking for help is seen as professionalism, not a weakness. And your commitment to caring is matched by the system's commitment to you. Can you imagine? So, this vision is not naive, it's necessary. And if we want our healthcare system to remain a place where people can both give and receive care safely over the long term, then we need to work towards that and we need to bring it into reality. So, closing thoughts. I want to, on the end where I began, with you. So, if nothing else lands today, I hope you take this with you. Your exhaustion's not a character flaw. Your concern for your own well being is not selfish, it's part of safe, ethical practice. Your voice matters in shaping what comes next. It's a shared responsibility, yours, your leaders, your organization, and other stakeholders like WorkSafe BC. So thank you all for the care you give, the courage it takes to keep showing up, which is unbelievable. You're heroes in my eyes for being willing to imagine something better for yourselves, your teams, and the people you serve. So your concern for your own well-being is not selfish. It's part of safe, ethical practice. Your voice and your actions matter in shaping what comes next. Thank you. From the bottom of my heart, thank you.
Yeah, so if we have the last 8 minutes here, if you had any questions for Mary, we can answer them in the chat now. I'll just stop the share here. Uh, Lots of thank yous in the chat, which is great to
Oh,
hear.
good.
Uh, Thanks for sharing this.
A full shot of Maddie sleeping. There's some therapy, some pet therapy for everyone.
Uh, I am missing a lot about myself, who I am. My focus is always the excellence and giving the utmost service, causing burnout to myself, for
But when
sure.
you think about it, you've probably heard this a million times, but it bears repeating. When you're on an airplane and they say there's, a problem and the mask drops down, put your own oxygen mask on first before you can help anybody else. And it's true. And I know it's hard in a system that's strained, but there is no other way. You have to take care of yourself, but also push forward this notion of the psychological safety standard to your leaders if this is not something you're talking about, and take action yourself among teams. Start the conversations. You do have agency.
For sure, for sure. I'm not seeing any questions in the chat. Perhaps people are still typing. So I will mention our upcoming webinars, which is January 2026. And it's very much on the theme of what Mary has been talking about today. So on January 15th, we have one on Move and Restore, and that's all going to be about trauma-informed tools for the mind and body. And that will also have a guided meditation session. And then on
Nice.
January 20th, there's one on energy management and a frontline reset and how you can do that while you're on shift. So lots of good stuff coming in the new year, especially in January, kind of following the similar burnout because we know how prevalent it is, especially with the holidays. And
Yeah.
a big
But
thank you.
hopefully now, though, folks will go into those sessions knowing that that's just one piece of the puzzle,
For
right?
sure.
That burnout isn't about, me being weak. Burnout is about this shared responsibility. So you need all legs of the stool, right? You can't just be, a meditation app isn't going to get you out of this. Although I'll tell you, I every day for years I've been using the Calm app, CALM, and I love it. And it really does center me before I start my day. So those things are helpful, but that's not going to certainly solve burnout. And the other thing I do say is if you think about it like um, literally burnout, if you think about it as taking a hot pan off a stove and the handle's really hot, the longer you hold on to that hot handle, the deeper the burn, right? And the longer it takes to heal. And if we forget about that lesson, we'll continue to go back and do the same thing till you're bumped out. You're shut down, which is where I found myself because I was overriding the signals, right? I didn't see those signals as a detriment, that I was overusing my strengths. So it's not a weakness.
For sure, 100%. Well, thank you
Anything
so
else?
much, Mary.
Comments?
And I don't see any other questions. I see lots of
I
thank
hope I
yous.
didn't traumatize everybody more, but I just wanted to give you some tools for your toolbox as well and increase your awareness.